एनेरिज्म है ब्रेन में, उसके बावजूद काम कर रहे हैं, ईवी malformation है उसके बावजूद चल रहे हैं, एक्शन यहाँ से कूदना वहां पर गिरना.
A brain aneurysm is basically an outpouching or ballooning out of the blood vessel in the brain that happens because of weakness in the wall of blood vessel. That can either be because of familial or genetic factors, or could be because of chronic hypertension or smoking. This aneurysm is fairly common entity, like can be found in 2 to 5% of the population, and many of the times they are incidental. Like we get a scan done for some other purpose, maybe a headache or a seizure, and we find a tiny aneurysm sitting inside the brain. In that case, we monitor the patient, we explain the red flags, and we see if there is any increase in the size of that aneurysm. But many a times these aneurysms can be symptomatic. They can either compress on a neighboring cranial nerve that would produce a cranial nerve palsy, or it can lead to bleeding if that ruptures. And this bleeding can either be a subarachnoid hemorrhage, wherein the patient will have severe headache and maybe altered sensorium, or it may lead to bleeding in the brain parenchyma. Now, depending on the location and the magnitude of that bleeding, the patient would have neurological deficits. Could be paralysis, could be vision loss, could be severe headache, could be loss of consciousness, and patient may even be comatose for a long time and may need ICU support and may require urgent surgery. So basically it is the location and the size of that aneurysm that matters, and also the history of the patient. If the patient has increased tendency of rupture, then in that case we might need to intervene early and go for elective surgery if indicated. Many a times, because these aneurysms are small, they may be silent, they may be asymptomatic, so we would just ask the patient to monitor for red flags and get the scan done at regular intervals. And these patients can continue with their life normally. They just need to make sure that the risk factors like smoking and hypertension are avoided. Regarding Salman Khan, he had trigeminal neuralgia, which is basically irritation of the trigeminal nerve which supplies our face, due to which there is severe facial pain. And that happens because of a vascular compression by an adjacent artery. Now, if there is any correlation between the trigeminal neuralgia and the aneurysm that Salman Khan is having, I can't say that for sure, because rarely that can coexist, but without any documentary evidence or assessing the scans, it's difficult for us to make out. But there could be a possibility that the two are also correlated.